Good morning, and good afternoon, and good evening, depending where you are. Welcome to the National Academy of Medicine's 2021 annual meeting. I'm so honored that you are joining me today. So let me begin with good news about some of our members. First, a huge congratulations to David Julius, who won this year's Nobel Prize for Physiology of Medicine. I also like to congratulate Eric Lander, who will speak to us later on. He has joined President Biden's cabinet as his chief science advisor and director of the White House Office of Science and Technology Policy. Eric will be joined by NAM members, Francis Arnold, Lisa Cooper, Sue Desmond-Hellman, Paula Hammond, and Catherine Witecki, who all recently been named to the President's Council of Advisors on Science and Technology, or PCAS as we know it. And finally, please join me acknowledging Francis Collins' enormous contributions to science through his leadership at NIH and his own research. Though he's stepping down as director, I know that he will continue to make important contributions. So thank you, Francis. You know, as I was thinking about this year's meeting and reflecting on the work we do as an academy, I was struck by how much the world has changed in the 7 years since I became president. When I took office, the Obama administration was in full swing, and Washington was preoccupied with fights over the Affordable Care Act. So much has happened since then that it feels almost like ancient history. The challenges we face today have become far more global, complex, and wide-ranging. Indeed, as I said in my address last year, our society is being confronted by triple existential threats: the devastating COVID-19 pandemic, the centuries-long scourge of systemic racism, and the climate change crisis has already begun to upend our world. These threats are not going anywhere or anytime soon. If anything, they are posing more challenges and uncertainty to society. And we first start with the pandemic, which for more than a year and a half now is still very much front and center in the US and all over the world. These past few months have been particularly frustrating as Delta variant caused yet another wave of illnesses and deaths. In the US, the greatest tragedy is that this wave could have been prevented if more people would have been masked and vaccinated. And globally, many low-income countries still do not have enough access to vaccines, leaving large swaths of the world's population highly vulnerable. Next, let's talk about racism. Rooting out systemic racism also continues to be an urgent priority for society. Last year, George Floyd's senseless murder at the hands of police forced a reckoning on race in this country and globally. Many leaders, including myself, pledged to take action, but we know much more work still needs to be done. And third, climate change. With unrelenting frequency, we're experiencing the damages brought by climate change, from more intense and more frequent wildfires in the West to a more active hurricane season and unprecedented flooding in the East. You know, the most recent report of the UN Intergovernmental Panel on Climate Change says that damage is now already baked in and that some devastating impacts are unavoidable. But if we act now, there's still an opportunity to keep that devastation from getting even worse. So as we confront these complex threats, I'm reminded of the quote from a German philosopher, Goethe, who said, "Knowing is not enough, we must apply. Willing is not enough, we must do." We know that we must do more to curb the pandemic, not just here, but everywhere. We know that we must provide equal opportunity for better health and well-being, not just for a lucky few, but for everyone. And we know that we must work together to be better stewards of our planet, not just for ourselves, but for the future generations. This is why our work at the National Academy of Medicine and across national academies is so important. We are hard at work to put the best evidence possible or available into action to improve people's life now and in the future. But we also must face a new reality. The challenges we face now and the new crises that will undoubtedly come our way are increasingly regional, national, and global. They are complex and multifaceted, crossing disciplines and sectors. And so just as the world and the nation are changing, so too we must change. Big societal challenges require new approaches to how we do our work. So instead of just reacting to what's happening in the world, we need to be more proactive, to anticipate challenges, to help society be prepared and avoid the worst case scenarios. We need to leverage our convening power to forge radical new partnerships and inspire action in multiple arenas across the sciences, across the public and private sectors, and around the world. Now more than ever, we need to communicate with the public about the values of science and to stand up for science when it's attacked, distorted, or ignored. And we need to demonstrate the power of science and medicine to create a better world, not just for a few, but for everybody. So in this year's President's Report, I will describe how NAM is rising to the challenge. Let me start with our work in pandemic. As summarized, next slide. Since the very early stages, the NAM and national academies have taken a strong leadership role in responding to COVID-19. Through our Standing Committee on Emerging Infectious Disease, we've engaged regularly with the U.S. administration and decision makers on key issues. The NAM has made a concerted effort to address issues related to pandemic in all our programs, from addressing pandemic response to tackling its disproportionate effects on communities of color, to examining how pandemic has impacted older adults, mental health, substance use disorder, and clinician burnout. And to get accurate public health information to the right hands, to the hands of healthcare providers, policymakers, journalists, and importantly, to the public. We've hosted hundreds of webinars and virtual workshops on a wide variety of topics and issues. Also, as you know, we've issued statements to speak out for science. Most recently, we've been focusing on building trust in COVID-19 vaccines. In addition to working on vaccine hesitancy directly with providers and communities, our Black NAM members developed a video urging Black Americans to get vaccines. This video has been viewed over 240,000 times. And thanks to Hispanic leadership on our council, our Latina members developed a similar video. Now, you have a chance to watch both of these videos during the breaks at 2:30 p.m. today, Eastern Time. And of course, combating misinformation around COVID-19 is a big part of the battle. Social media companies, so often the fuel for spread of misinformation, need to do more to step up and do right. An important first step for these platforms is to identify and prioritize credible sources of information for their users. So when NAM Council member Karen DeSalvo, who's now the Google's Chief Health Officer, asked NAM to help to work with YouTube, we agreed without hesitation. We appointed a multidisciplinary advisory group chaired by Raynard Kington, which engaged in extensive deliberation, solicited widespread public input, and released a publication, which you can see on the slide. The publication provided a set of criteria to help identify credible information, the attributes of credible sources of information, and categories of entities that could serve as reliable source of information. So, the Surgeon General Vivek Murthy referenced our publication in his recent public advisory on misinformation health. Going forward, we are committed to furthering our work in this area, engaging with many more social media platforms and partnering to extend this initiative globally. Well, here in the United States, the pandemic has reviewed the best and worst of our healthcare system. A system capable of extraordinary care and innovation, but one that has perpetuated inequities and is unprepared to completely meet the challenges of the 21st century. So as we emerge from COVID, NAM is looking to the future. We must capture those important lessons to create a system that is equipped for a rapidly changing world. So, indeed, after President Biden issued a public letter to Chief Science Advisor Eric Lander asking for guidance on specific questions regarding science, technology, and public health preparedness, we, the NAM, convened a working group to identify key priorities based on lessons learned from COVID-19. This slide will show you the key priorities identified. One priority we identify is transforming the United States public health infrastructure. It is fragmented and severely under-resourced, with workforce shortages and outdated technology systems. So we have to reimagine, reorganize, and invest significantly in our nation's public health. The working group also urged major improvement of our health data system to prepare for the next emergency. You know, our current system is not interoperable and abounds with deficiencies, making it difficult or nearly impossible to glean actionable insights. We need an improved data health ecosystem that focuses on foundational elements such as technical infrastructure, data architecture, and modularity. Also, protecting and improving the public's health requires robust capabilities for rapidly identifying new infectious health threats. So we need to enhance pandemic surveillance, forecasting, and virus tracking. I'm so pleased that the CDC has taken on an important first step by establishing the Center for Forecasting and Outbreak Analytics. The overarching priority of this nation should be to develop a national strategy for pandemic prevention and preparedness. The Biden administration unveiled the American Preparedness Plan, a $65 billion proposal to remake the nation's pandemic preparedness infrastructure. I'm so gratified that many of the elements outlined by our working group are contained in this plan. And later, you'll hear that I'll be interviewing Eric Lander during the scientific meeting on some of these issues. This slide says, above all the stuff we talked about earlier is preparedness. But as you know well, we really need a long-term transformation of an entire U.S. health system. The NAM Leadership Consortium, led by Mike McGuinness, convened leaders from 9 sectors of the health system to assess the impact and experience during the pandemic and recommend changes for the long-term future. You can see the 9 sectors listed in this slide. First, a cross-cutting theme is equity. We must commit to pursuing equity across all domains of health system. This includes addressing systems, policies, and barriers that perpetuate health disparities and ensure that we see meaningful progress towards revamping them. Second, COVID has forced major changes in how we deliver care. Providers have to swiftly leverage telehealth and other technology, streamline operations, and embrace non-traditional care settings. We must build on this momentum to transform healthcare delivery so that it's safer, more efficient, and easier to access. We should innovate and advance effective ways to engage, monitor, manage patients remotely at their homes and in the community while ensuring equity in access to care. Third, we need to reconsider how care is financed. COVID-19 has renewed the impetus for transitioning away from fee-for-service and towards value-based payment models, which could drive transformation in other sectors as well. Furthermore, this pandemic has exacerbated already high rates of burnout among our clinicians and frontline workers. We must invest in their well-being. So these are some of the priority actions. They represent meaningful steps towards system transformation across the sectors. Now, lessons from COVID-19 can and should also inform the overall public health measures, and especially as we enter the flu season on influenza preparedness. So, sponsored by HHS, we formed an international commission to do just that from a global and US perspective. This initiative issued 4 reports, as you see in this slide, informing future influenza vaccine development, supply chain issues, public health interventions, diagnostics and treatment strategies, and international collaboration, innovative partnership, and financing based on lessons learned from COVID-19. I'm also proud that NAM is actively involved with many global activities related to pandemic preparedness response. As shown in this slide, NAM showed a secretariat for the G20 high-level independent panel that's shown on the right side, which generated an important report called A Global Deal for Pandemic Age that calls for critical actions and doubling of international financing to at least $75 billion over the next 5 years to close the gaps in pandemic prevention and preparedness. In addition, along with other NAM members, I've been actively engaged in the Global Preparedness Monitoring Board to provide independent monitoring to ensure preparedness for global health crisis. And in the Global Access to COVID Tools Accelerator, or ACT-A, and COVAX, which works towards equitable access to COVID-19 tests, treatments, and vaccines worldwide. The pandemic has shown a harsh light on another crisis, and that is racial and socioeconomic disparities in healthcare and health outcomes. It is clear that people of color have disproportionately suffered and died in this pandemic because of long-standing inequities in our society. Last year, I, on behalf of NAM, made a public commitment to address racism and center equity in all that we do. We are committed to creating an internal environment and cultural diversity and equity. We will have an equitable lens, an equity lens, in all of our programs and activities. A signature initiative shown on the third bullet is our Cultural Health Program, a multi-year effort supported by Robert Wood Johnson Foundation to identify strategies to achieve health equity. We're now entering the second phase of this program, which will focus on how to address the root causes of inequity. As you can see in that bullet, we're planning 2 consent studies addressing structural racism in health and longitudinal and cross-generation causes of persistent health inequities. And of course, those of us in STEM must address racism within our own communities. The past summer, the National Academies held a summit on diversity, equity, inclusion, and anti-racism in 21st century STEM organizations. That includes universities, research institutions, and our own academies. The summit was informed by the work of our roundtable on Black men and Black women in science, engineering, and medicine, led by Cato Lorenzo, an NAM member. You know, within our own academy, our hard work and increasing diversity of NAM members paying off. Our members are becoming more diverse, not only racially and ethnically, but we're also consistently electing more women and more people from underrepresented areas of the country. As shown on this slide, we have much to be proud of. The class of 2021, which was just announced this morning, 50% of this class of new members are underrepresented minorities, a record number. And this class also includes a record number of women at 52%. Another record is the election of 4 Native Americans, Alaska Natives, to membership. I am so proud of the development of NAM. You know, at the NAM, we are absolutely committed to practicing what we preach. To lead our internal efforts, we appointed Ivory Clark as NAM's Equity Inclusion Officer and recruited Joy Washington to the new position of Senior Administrative Officer to implement the changes. We launched the Staff Committee to Advance Racial Equity, or CARE, to put our commitment into practice, as you can see in this slide, the mission and our vision. Ivory is also working closely with Laura Castile-Page, our first Chief Diversity and Inclusion Officer across the entire academies, to develop an academy-wide strategy for promoting diversity in our workforce and culture. Well, with regards to climate change, you know, we can no longer pretend that our climate catastrophe can be dealt with down the road or kick the can down the road, and that only affect future generations. Climate change is here and now. Clearly, climate change is not just an environmental catastrophe, it is also a public health crisis. Some 20 million people are dying every year globally because of key factors linked to climate change. And sadly, just as we've seen with pandemic, the worst impacts of climate change are experienced by people of color and other vulnerable populations because long-standing inequities in our systems of health, housing, food security, and employment. We in health medicine have an obligation to act and to start treating climate change as the public health crisis that it is. We can and should raise the alarm about these threats. We have a duty to advocate for health and equity to be at the center of climate change planning and policy. The Biden administration has pledged to make climate change a top priority with a major focus on environmental justice. We're working closely with these issues with Dr. Rachel Levine, Assistant Secretary for Health, who oversees the new HHS Office for Climate Change and Health Equity, as well as the White House National Climate Advisor, Gina McCarthy, and their teams. But you know, we in the health sector must also be accountable for reducing our considerable carbon footprint. In the US alone, our sector is responsible for a whopping 8.5% of the nation's carbon emissions, which occur in every part of the healthcare system, from hospitals to clinics, from home care to nursing homes to research facilities, and throughout the entire healthcare infrastructure, from medical devices, drugs, equipment, manufacturing, to the supply chain. So I believe as a major contributor to climate change, we must be part of the solution. That is why we launched a signature global initiative, the Grand Challenge on Climate Change and Human Health. I did that at last year's annual meeting, and we've been working hard at this Grand Challenge. This multi-year global effort, chaired by NAM members, Judith Rodin and Phil Pizzo, will harness bold thinking and radical, innovative, and collaborative partnership to focus on the following strategic initiatives as shown on this slide. First, communicate climate crisis as a public health and equity crisis. Second, develop a comprehensive and long-term roadmap for systems transformation. Third, to prioritize and catalyze multi-sectoral actions to drive health sector transformation. And fourth, to stimulate bold and interdisciplinary solutions to accelerate the pace of innovation and transformation. You'll hear more about the Grand Challenge later today at the President's Forum, so please join us. We have outstanding experts to discuss this. Now, an important part of the Grand Challenge, which is bullet number 3, is decarbonizing the U.S. health sector. Recently, we launched an action collaborative on this topic, a public-private partnership, bringing together leaders from across the U.S. health system, the federal government, industry, hospital systems, private payers, clinicians, academia, all together to identify and implement actions aimed at reducing the environmental impacts of the health sector and strengthening sustainability and resiliency. I'm co-chairing the Action Collaborative along with George Barrett, the former chairman and CEO of Cardinal Health, and Sir Andrew Whitty, the CEO of United Health Group. And we're really excited to work closely with the Biden administration and Dr. Rachel Levine, the Assistant HHS Secretary, who also serves as a co-chair of this collaborative. Now you can see in the bottom of the slide, the publication just came out this week. The 4 of us wrote about a call to action, because this action collaborative will focus on reducing our carbon footprint by focusing on key areas, and these key areas will be taken on by working groups: healthcare infrastructure supply chain, healthcare delivery, health professional education and communication, and policy, financing, and metrics. These working groups will work together to address these issues, and we have high hopes for impact of this action collaborative. I should also point out, working closely with divisions across the entire academy, science, engineering, and medicine on climate-related projects, and to leverage the expertise of the other academies to develop an integrated approach across the academies. So as I'm drawing this address towards closing, let us not forget the many important projects we are undertaking, as shown in this slide. Our action collaborative on promoting clinician well-being and fighting burnout has never been more important than ever during the pandemic. The same is true for our action collaborative on countering the opioid epidemic, as well as our recent study, which updated the 2010 Future of Nursing Report for 2020 to 2030. And importantly, the NAM Committee on Emerging Science, Technology, Innovation, and Health and Medicine is developing a cross-sectoral governance framework that guide the development and use of transformative innovation while mitigating potential societal risk and unintended consequences. Lastly, I'm excited to tell you that our publication, NAM Perspectives, was recently accepted to be indexed in PubMed Central this year, and it'll go retro for the past 2 years. I believe this will increase the reach and impact of our publications. So last night, we launched the public phase of the campaign for NAM. It is the most ambitious fundraising campaign in the Academy's history. The campaign goes an ambitious $100 million, which will provide resources support NAM to fulfill its mission. Now, you see some of them listed here. They are not everything, but they are the key areas that we are raising money for. The good news is at this public launch, we're already at 85% of our goal. And I just want to thank our members and friends who have been already participating in the campaign. You know, I'm confident that with the help of you, our members and friends, we're going to reach and surpass that goal in a few years. I encourage everyone to join your fellow NAM colleagues to make a gift of any size to any area that's meaningful to you. As I conclude this address, I want to acknowledge that although we still have a lot of work ahead of us, I'm grateful for the progress we have made so far. This year has presented many challenges, but it also provided some important, though hard-learned lessons. For one, we now grasp in a very real way that while our role as independent, objective advisor to the nation is more important than ever, we must also find ways to enable action. We must stand up and advocate for science and research. And in today's information environment, communicating clearly about science and countering misinformation is an absolute must. And each one of us needs to live up to this responsibility. We've also learned how interconnected we are. When it comes to crises we face, we're truly all in this together. We need solidarity, new partnerships, new approaches, and how we collaborate across borders, across discipline, and across our societies. You know, the challenges ahead of us are not for the faint of heart. We need to create a more just, equitable society and healthier planet for ourselves and for future generations. These are big, complex goals with health and medicine right at the core. Well, this brings me back to the saying by Goethe, knowing is not enough, we must apply. Willing is not enough, we must do. With the power of science and medicine at our disposal, I firmly believe that together, there's no challenge we cannot overcome. It's going to be hard work, but it's important work, and it matters. So let's keep doing it together. Members, it's a privilege for me to serve this incredible academy as your president. Thank you so much for your support and your great contribution. Thank you.